Hello, this is Dr. Ross, and this is the Structure of Joints video lecture for my class and for Dr. Camp's Anatomy and Physiology. So in this lecture, we're going to talk about the anatomical classification of joints based on structure, and I'm going to provide examples of each. We are going to describe the functional classification of joints based on the amount of movement permitted by that joint, and we'll provide examples of each. We'll explain the relationship between the anatomical classification and the functional classification of joints, as well as identify and describe the major structural components of a typical synovial joint. And then we'll talk about the 6 structural types of synovial joints, describing the anatomic features, identifying locations in the body where they're found, and predicting the kind of movement each joint allows. Okay, so first let's start with types of articulations. All right, so let's review what is an articulation. So an articulation is the point at which 2 or more bones meet. Okay, so that's going to be a joint or an articulation. So joints or articulations are responsible for movement, of course, the movement of the limb, the stability, and there are 2 ways to classify joints. We can classify them on the basis of their structure or on the basis of their function. So let's start with the structural classifications. The structural classification divides the joints into 3 subcategories: fibrous, cartilaginous, and synovial joints. And this depends on the material of the joint and the presence or absence of a cavity in the joint. So the bones of a fibrous joint are held together by fibrous connective tissue. There's no cavity or space present between the bones, and so most fibrous joints do not move at all. We also have cartilaginous joints. These are joints where the bones are connected by cartilage. There are 2 types of cartilaginous joints, which we'll talk about later when we get further along in the video lecture. Synovial joints, these are the only joints that have a space between the adjoining bones, and these allows for greater movement. Now, if we talk about categorizing them by function, we have 3 different types. Functional classification is determined by the amount of mobility found between the adjacent bones. And there are 3 classifications: synarthroses, amphiarthroses, and diarthroses. So synarthroses are joints that are immobile or have no motion. Amphiarthroses are joints that have some motion, they're slightly movable. And then diarthroses, these are freely movable joints. So they're free motion in at least one direction, but it can be more than one direction. So let's talk about fibrous joints first. So fibrous joints, bones of fibrous joints are held together, as I mentioned, by fibrous connective tissue. There's no cavity or space present between them, and they don't really move very often. So there are 3 types of fibrous joints. There are sutures, syndesmoses, and gomphoses. Gomphoses, which is shown here, occur between the teeth and the tooth socket. Okay, so that refers to the way the tooth fits into the socket like a peg. So the gomphoses line the upper and lower jaw in each tooth. The tooth is connected by connected to the alveolar process of the mandible, and there is a connective tissue called the periodontal membranes, which can also be called a ligament. So these joints have little mobility as teeth are held firmly in place, but they can be moved using orthodontics like braces. Sutures are found only in the skull, and they possess those short fibers of connective tissue, and that holds the skull bones tightly in place. And then syndesmoses, these are joints which are in which the bones are connected by a band of connective tissue, which you can see in this image is kind of this white band between these 2 bones. This allows for more movement than in a suture. So as an example of a syndesmosis is the joint of the ulna and radius, which is shown in this image. The length of the connective tissue fibers, so in this case that's called the interosseous membrane, the length of those connective fibers determines the amount of movement of these types of joints. So the longer those fibers are, the more movement there's going to be. Now, before I move on, I want to just point out the singular and plural versions of these words. So gomphosis is singular. Gomphosis, that would be with an SES on the end. That's going to be plural. Syndesmosis is singular. Syndesmoses, SES, is plural. So if I'm talking about multiple joints of type C, then that would be syndesmoses. If I'm just talking about one, that is a syndesmosis. Okay, so just moving forward, keep that in mind. All right, now let's talk a little bit about cartilaginous joints. So cartilaginous joints are those in which the bones are connected by cartilage, and there's two types of cartilaginous joints. You have synchondroses and symphyses. All right, so in synchondroses, the bones are joined by hyaline cartilage, which is a type of cartilage. These are immovable joints. Synchondroses are found at the epiphyseal plates of growing bones in children and adolescents. So the epiphyseal plate is just where new bone growth occurs, and you're going to find that at the end of each long bone. You can also find this type of joint at the costochondral joints, and that's where the costal cartilage comes together. And then you can also find them at the joint between the first rib and the sternum, or between the ribs and the sternum. You also have another type of cartilaginous joint called a symphysis. These are going to be joints that contain fibrocartilage. These joints are slightly movable joints. So symphysis are found at the joints between the vertebrae. An invertebral disc is what's going to lie between those two vertebrae. And it's going to be composed of fibrocartilage. Each disc forms a symphysis to allow slight movement of the vertebrae, and so it kind of acts as a ligament to hold the vertebrae in place, and it also functions as a shock absorber for the spine. You also find this type of joint between the two pubic bones, and this is called the pubic symphysis. All right, so let's talk about synovial joints. Synovial joints are the only joints that have a space between the adjoining bones. Okay, so this space is called a synovial cavity or a joint cavity. This space contains synovial fluid, and the synovial fluid is there to lubricate the joint. All right, so what does this do? It reduces friction and it allows for greater movement. It's a cushioning mixture of water, proteins, and proteoglycans. So that's pretty much what makes up that synovial fluid. The ends of the bones in a synovial joint are covered with articular cartilage, which is a hyaline cartilage. Okay, and then the entire joint itself is surrounded by an articular capsule. Okay, and this is composed of connective tissue. What this does is it allows movement of the joint, as well as it provides some resistance to dislocation. So when you have a lot of flexibility in your joint, they're actually more at risk for dislocation and things like that. So this articular capsule is going to try to prevent that. Now, this includes the synovial membrane, and this actually is what secretes the synovial fluid. Articular capsules may also possess ligaments that hold the bone together. So this here is a simple synovial joint. Many joints have additional fluid sacs called bursa or tendon sheaths, and some include fibrocartilage articular discs known as menisci. We're going to talk about that in the next slide. Okay, so here we are looking at some more synovial joints. We're going to start with the knee on the left. And so we can see that there are several features that were present in the previous slide. You can see the synovial membrane, the articular capsule, the articular cartilage, the joint cavity as well. So this joint actually includes several bursae. These are tiny sacs of fluid that basically are there to facilitate motion. They provide cushion, a thin cushion, They reduce friction between the tendons, the ligaments, the muscles, also the skin, which has to move over the bones during joint movement. These include the suprapatellar bursa, the prepatellar bursa, the infrapatellar bursa, as well as the bursa that's deep to the gastrocnemius muscle. We'll talk about that muscle when we get to the muscle section. So in addition, when you have you can get inflammation in the bursa. This is called bursitis. So inflammation of the bursa near a joint, it will cause pain, swelling, or tenderness of the bursa, as well as the surrounding area, and it can cause a lot of joint stiffness. Bursitis is most commonly associated with the bursa found at or near the shoulders, hips, knees, and elbow joints. So this knee joint also has another feature called a meniscus. This is just a fibrocartilaginous tissue, and its function is really just to disperse the weight of the body and reduce the friction during movement. All right, so moving over to the right. So on the right, we have an image showing the wrist and hand from the anterior. This image shows many tendons of the hand. These are basically all these white stringy looking things are going to be the tendons. Let's recall that a tendon is a tough band of connective tissue. It connects the muscle to the bone, and it's capable of withstanding a lot of tension, meaning it's resistant to tearing. The tendons are often protected by layers of connective tissue known as tendon sheaths. Okay, so we can see some of those here in blue. Basically, the tendon sheaths are filled with a lubricating fluid, and this allows the tendons to move smoothly and freely. All right, and then if you look at the very top of the image, you can see an open tendon sheath, and you can kind of see how that sheath just wraps around the tendon in that digit. Okay, so for the next section, we're just going to identify some articulations by type, and we're going to go through them by structural class as well as functional class. So the invertebral joint consists of two adjacent vertebrae with a cushion in between. Okay, so the structural class is cartilaginous, and the functional class is amphiarthrosis. The glenohumeral joint, okay, that's the shoulder joint. This is going to have a structural class that is synovial, and the functional class, because that's freely movable, is diarthrosis. The intercarpal joint in this image is shown with the red lines in between. Again, that's a synovial joint, and the functional class is diarthrosis. Here we have a coronal suture. The structural class here is fibrous, and the functional class is synarthrosis. Here we are looking at the pubic symphysis, and that's between those two bones there in the red square or rectangle. This is going to be structurally a cartilaginous joint and functionally amphiarthrosis. That's because it allows some movement. And then finally we have our interphalangeal joint shown here. This is going to have a synovial structural class and is diarthrosis. So remember, if it's a synovial joint, you automatically know the functional class is diarthrosis. So let's talk about the synovial joints in a little more detail. So first, let's do this classification. So just like the joints, the general classification of joints, we can further classify synovial joints two ways. You can do them by structure or by motion. And so by structure, you have plane, pivot, hinge, condylar, saddle, and ball and socket. And this has to do with how they appear when you look at them, and we'll see that as we go through these slides. And then you can also classify them by motion. So if it's non-axial, that means there's no angular movement, only a sliding motion. Uniaxial, that's going to be one angle of motion. Biaxial means two angles of motion will be allowed, and then I'm sorry, did I say emotion? Two angles of motion. And then tri or multi-axial, three or more angles of motion, meaning it's basically freely movable. All right, so types of synovial joints, starting with non-axial / sliding motion. So these joints allow only gliding or sliding movements. The movement is limited by the tight joint capsule in this case. So examples include the intercarpal joints of the wrist, the intertarsal joints in the ankles, and the acromioclavicular joint between the acromion of the scapula and the clavicle. So these types of bones produce very little rotation or angular movement. Right? So the next one is uniaxial. A uniaxial joint is only going to allow for motion in a single plane around a single axis. And there's two structural classifications. For these, you've got, for uniaxial, you've got pivot joints and hinge joints. So in a pivot joint, one bone rotates around the rounded portion of another. Okay, so an example of this is shown in this image. It's the atlantoaxial joint, which is found between the C1 vertebra, the atlas, and the C2 vertebra, the axis. So here what you have is that upward projecting din of the axis that articulates with the inner aspect of the atlas. And then, of course, it's held in place by a ligament. And so rotation at this joint allows you to turn your head from side to side. In a hinge joint, the convex end of one bone articulates with the concave end of the adjoining bone. So this type of joint allows for bending and straightening motions along a single axis. So a good example is the elbow, okay, where you have articulation between the trochlea of the humerus and the trochlear notch of the ulna. All right, so biaxial, these are going to be joints that allow for two planes of movement, and you're going to have two biaxial joints. You have the condylar joint and the saddle joint. So in a condylar joint, there's a shallow depression at the end of one bone that articulates with a rounded structure from an adjacent bone. Excuse me. So your knuckle or your metacarpophalangeal joints of the hand are good examples of this type of joint. You also have saddle joints. This is where you have the articulating surfaces of the bones have a saddle shape. They're concave in one direction and convex in the other. Okay, and so this allows the two bones to fit together almost like there's a rider sitting on a saddle, no matter which orientation you look at. So the primary example is the first carpo-metacarpal joint between the trapezium, which is a carpal bone, and the first metacarpal bone at the base of the thumb. So this joint provides the thumb with the ability to move away from the palm of the hand in two different planes. So the last type are multiaxial. These are going to be joints that can move in three directions or more. And so this is going to be the ball and socket joint. Okay, that's basically the only ones that fit in this category. These joints have the greatest range of motion. The rounded head of one bone, called the ball, fits into the concave portion of the other bone, which is the socket. There are two of those on the human body. You have the acetabulofemoral joint, which is at the hip, and the glenohumeral, which is at the shoulder. The shoulder is more flexible, and that's because it has a more shallow socket formed by the glenoid cavity, and that allows for a little bit more motion. But the hip has a deeper socket at the acetabulum, and it also has some stronger ligaments, and that restricts the movement. But that provides more stability, which you would want for your lower limbs. All right, so now let's do one more little activity. We're going to identify the synovial joints by type of, we're going to do both structural, class, and range of motion. So let's start with the glenohumeral joint. Shown here, this is at the shoulder. This is going to be a ball and socket structural joint with multi-axial range of motion. The intercarpal joint, again shown in red, this is going to be a plane. The range of motion is non-axial or sliding. The proximal radio-ulnar joint, shown here, this is going to be a pivot joint and is uniaxial. The radiocarpal joint, shown in green, okay, this is a condylar joint and it is biaxial. Finally, the thumb, which is the carpometacarpal, that is going to be a saddle joint, and it is also biaxial. Okay, let's do a few more. So here we have the interphalangeal joint, which we've already seen. This is a hinge joint, and it is uniaxial. The tibiofemoral joint, shown here, this is also a hinge joint, so it's uniaxial. The atlantoaxial joint, this is a pivot joint, and is uniaxial. And the acetabulofemoral joint, shown here. This is a ball and socket joint, and it is multiaxial. And that is it for this presentation. Thank you.